So I'd like to call the meeting to order, and I have a public comment to read. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in the meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. And so we move on with our agenda. And I do want to say that I want to note that Mr. Henry, Mr. Hudson, and Mrs. Reiner have been excused from in-person attendance for their health reasons. And now I'd like to have approval of the orders of the day. Can we have a motion?
Motion.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Next, I'd like approval of the minutes of the meeting of June 20th, 2022. I have a motion and a second. All those in favor say yes.
Yes.
Opposed? Hearing none, motion passes. Next, there are no board reports. And next on the agenda is our medical staff reports. We have joint reports of the Sarasota Memorial Hospital, Sarasota, and the Venice Hospital medical staffs, and Dr. James Fiorica, our Sarasota Memorial Healthcare System Chief Medical Officer, has a report. Do you, Doctor?
No report today.
You do not. Thank you for that. Next, I will proceed to Dr. Lichtenstein, who is our Chief of Staff at the Sarasota Memorial Hospital. And Doctor, do you have a recommendation for us?
Yes, please. Thank you, Madam Chairwoman. I would ask for a motion approving the Sarasota Memorial Hospital Sarasota Division cardiovascular disease left atrial appendage amulet device privileging criteria as recommended by the SMH Sarasota Medical Executive Committee.
Second.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Next, we have Dr. Chris Jefferson. He's Chief of Staff at Venice Hospital, Sarasota Hospital, and he has a recommendation for approval.
Thank you, Madam Chairwoman. You may recall that under the SMH Venice medical staff bylaws, one of the eligibility requirements for serving as a medical staff leader is appointment to the active staff for a period of 5 years, unless an exception is recommended by the Medical Executive Committee and approved by the board. Because no member of the SMH Venice medical staff can currently meet that criteria, I'm asking for a board motion accepting the SMH Venice MEC recommendation that the board grant a blanket waiver of the 5-year requirement for those SMH Venice medical staff members who meet every other criteria for the various positions and who, in the determination of the MEC, are otherwise qualified to serve based upon their demonstrated willingness, capability, and commitment to serve, and that such blanket waiver remain in place until such time as any member of the SMH Venice medical staff has appointed to the active staff for a period of 5 years.
Second.
We have a motion and a second. All those in favor, please say yes.
Yes.
Any opposed? Hearing none, motion passes. Thank you, Doctor.
Thank you.
Next, we have our secretary report by Greg Carter. Secretary, Greg, do you have relevant dates?
Yes, thank you. On Monday, August 15th, the board will meet, start with Commission and Planning Committee at 9 o'clock. At 10:30 will be the Finance Committee. At noon will be closed session, the hospital board meeting. At 12:30, lunch, financial review, and at 2 p.m. will be board meeting.
Thank you, Mr. Carter, for that. Next, we have our treasurer's report with Joseph DiVirgilio, treasurer.
Yes, Madam Chair, I have a a motion for approval of the bad debt and charity care, and I move approval of the bad debt and charity care for the month ending June 30th, 2022, in the amount of $18,406,000.
We have a motion and a second. All in favor, say yes. Any opposed? Hearing none, motion passes. Thank you, Mr. DiVirgilio. Next, we have our financial highlights with William Wojcik, our Chief Financial Officer.
Thank you, Madam Chair. And I'll start with total revenue. And I'll remind everyone that the fiscal year-to-date numbers represent 9 months of activity, which is 3 months of this fiscal year. We'll start with system total revenue in the rating agency format. The month of June, we have $121,384,000, compared to a budget of $110,115,000. Fiscal year to date, total revenue $1,106,127,000, compared to a budget of $11,039,000.
Bill, can you speak up a little, please?
Sure, we saw the system total expenses in the rating agency format for the month of June, $114,119,000, compared to a budget of $104,279,000. Through 9 months, total expenses of $1,035,699,000, compared to a budget of $953,884,000. Operating income for the system for June, $7,265,000, compared to a budget of $5,836,000. We had an operating margin of 6%, and we budgeted an operating margin of 5.3%. Fiscal year to date, again, this is through 9 months. The operating income, $70,728,000, compared to a budget of $57,155,000. And operating margin through 9 months, 6.4%, compared to an operating margin budgeted 5.7%. Moving to statistics for the hospitals, and these are all fiscal year to date 9-month numbers. Average daily occupancy, 759 patients per day, compared to a budget of 715. Admissions and observation cases, we have a total of 47,130, compared to a budget of 45,397. At the Sarasota campus, the actual length of stay for acute care patients, 4.95 days, compared to last year, 4.65. And Venice campus, actual acute length of stay, 3.95 days. Of course, last year they weren't open, so no comparison there. Continuing with statistics for surgery cases for the hospitals, 20,949, compared to a budget of 21,476. Births so far, we have 3,213, compared to a budget of 3,354. And outpatient registrations, total through 9 months, 399,103, compared to a budget of $390,030. Emergency Care Center registrations among our 3 ECCs, $110,499, compared to a budget of $107,960. And case mix index for Sarasota campus for all patients, 1.94. At Sarasota campus, Medicare CMI 2.04. And at Venice, for all patients, 1.49. And for Venice's Medicare patients, 1.48. Madam Chair, this concludes my presentation. Any questions?
Thank you, Mr. Wojcik. Next, we have our committee reports, and we have our joint finance and audit committees report with Sarah Lodge, Chair of the Finance Committee.
Thank you. The minutes of the May 16th, 2022 meeting of the Finance Committee were approved. Next, we had Todd Webster and Heather Snyder for KPMG present their audit plan and strategy for external audit of the fiscal year 2022 financial statements of Sarasota County Public Hospital District. They reviewed their risk assessment, plan deliverables, and timeline in their independence. No motion necessary. Bill Wojcik, CFO, presented information for the committee to consider for setting the preliminary tax millage rate for fiscal year 2023. He outlined the system's growth plans for fiscal year 2023 and beyond, and he also reviewed the cost pressures that are impacting the system in preparing the budget for fiscal year 2023. The taxable value of the property in Sarasota County, including the value of new construction, has increased 17.9% over the past year. Management's recommendation is to set the fiscal year 2022 preliminary millage rate at 1.0420, which is the same as the current millage rate. The committee discussed the information provided. At this time, I move to set the fiscal year 2023 preliminary millage rate at 1.0420, which is the same as the current millage rate, and to set the first public hearing to adopt the proposed budget and millage rate for September 6, 2022 at 5:01 p.m. and the second public hearing to adopt the budget and the millage rate for September 19th, 2022 at 5:01 p.m. Both hearings, currently scheduled to be held in the old boardroom and auditorium on the first floor of the Sarasota Memorial Hospital Sarasota campus, located at 1700 South Tamiami Trail, all as recommended by the Finance Committee.
We have a motion and a second. Is there any discussion? All those in favor say yes.
Yes.
Opposed? Hearing none, motion passes.
Bill Wojcik, CFO, informed the committee that draft documents have been prepared for the issuance of the fixed rate revenue bonds in the aggregate principal amount of not to exceed $150 million. The following documents were prepared and have been reviewed by the district's bond counsel, CFO, associate chief legal officer, and the underwriters council and trustee council. A draft bond purchase agreement, a draft trust agreement, a draft supplemental indenture for obligation number 39, a draft preliminary official statement, and a draft continued disclosure agreement. A resolution has been prepared by the district's bond counsel for the board to authorize the issuance of the bond and to delegate authority to board officers to execute documents necessary for the bond issuance. I'm going to ask Carol Ann to summarize the resolution, which was provided to each of you and is published on our website.
Y'all will be relieved to know that I'm not going to read the resolution in total, but I will say that in material terms, it's summarized as providing pursuant to the authority of the board and consistent with the board's master trust indenture that governs the issuance of indebtedness. The board will today, or you should later today, in a few minutes, adopt a resolution, a copy of which was published on the board's website and provided to each board member in advance of this meeting and discussed in full at the joint meeting of the Audit and Finance Committee earlier today, which describes with particularity the purpose, authority, and mechanisms by which the board will issue and use the proceeds of the described indebtedness to finance the Cornell Behavioral Health Pavilion and the SMHN's bed tower. In addition to authorizing the execution of the documents that Mrs. Lodge just talked about, the resolution further authorizes the issuance of the district's fixed-rate hospital revenue bonds, Series 2022, in the aggregate principal amount not exceeding $150 million, describes the conditions under which the final terms, conditions, and provisions of that indebtedness approved, delegates to the chair or vice chair of the board the authority to approve the final details and the forms of the bonds, establishes that it is in the best interest of the district to issue bonds, and authorizes the sale of the bonds and the conditions of the sale, and that using the proceeds for the projects as outlined accomplishes a public purpose as defined in the board's enabling legislation, and establishes the material terms of the bonds, including the final maturity date of no later than July 1, 2053, the sale date of no later than December 31 of 2022, and the all-in interest cost of 5.5%.
I move adoption of this resolution as published and as recommended by the Finance Committee.
We have a motion and a second. Any discussion? All those in favor, say yes.
Yes.
Any opposed? Hearing none, motion passes.
Lastly, we had Todd Nance, Director of Audit Services, then provide an update on the following 2021-2022 internal audit projects. Fiscal year 2022 audit plan status, ID badge, access controls, business operations, endpoint encryption controls, and IT security. All findings were discussed and were considered to be at moderate risk. Management has initiated corrective action plans for all findings. There's no motion necessary. That was just for information purposes, and this concludes my report.
Thank you, Sarah. Next, we have our Quality Committee report with Dr. Richard Raymeyer.
Quality Committee meets in a closed session, so no report available.
Thank you, Doctor. Next, we have our President's report with David Barringer, President and CEO.
Thank you. I'm going to start the same as I do each month and look at our organizational report card for our year-to-date activity for the first 9 months. So we have 5 different areas of concentration, the first being service. We have a goal of having 8 out of 10 of our service areas be at or greater than the 75th percentile. I'm happy to report that we're having 9 out of 10 of those areas are meeting or exceeding that indicator at this point. I'll go over the details here in a minute. In the people area, we have our goals are having our new hire retention percentage of regular and full-time employees hired in FY 2022 still be employed with us by the end of September 30th, 2022. Our goal is to have 83% of these or higher. I'm happy to report we're exceeding that goal at 87.75%. In the quality area, we have our goals to have our combined overall standardized infection rate be less than 0.85. I'm happy to report that we are exceeding that as well at 0.74. And just to remind the board, we already set that goal pretty aggressively. The expected number or the national average is 1.0, so we're quite a bit lower than that. In the finance area, you've already heard from our CFO, Bill Wojcik. We have our organizational goals having our operating margin be at 5.5% or higher. We are tracking that to be 6.1% for the year. And then finally, in the growth area, we have 2 goals. The first being our inpatient admissions and observation outpatients. For the year being 60,119 patients. We are tracking higher than that at 62,428,000. And in the outpatient registrations, we have our goal of having 1,125,000. We are tracking higher than that as well at 1,141,000. When we look at our patient experience report card in a little bit more detail, we see that in the likelihood, I will orient you on the report card, likelihood of recommending. The far left are the 10 areas that we survey. The middle column is what our actual score is. The next column over is the national median score. And then finally, far right is the 75th percentile score, which is the one we track to. You will see that 9 out of 10 of our areas meet or exceed the 75th percentile score. And we have one first physicians group that is 1 point away from that, but meeting the national medians. So thanks to all of our folks for all their hard work. Next up, SMH was named among the nation's top 100 hospitals. SMH Sarasota was recently named one of the nation's top 100 hospitals and among the top 40 teaching hospitals. In the 2022 Fortune Meredith 100 Top Hospital Rankings, SMH outperformed thousands of hospitals across the nation in all clinical and operational benchmarks evaluated. This is the 6th year that Sarasota Memorial has been recognized as a top 100 hospital by Fortune Meredith, which is previously known as Watson Health. It's also ranked repeatedly among the top 50 cardiovascular hospitals. In this year's study, SMH teaching programs were spotlighted, with SMH Sarasota listed among the top 5 teaching hospitals in Florida and top 40 in the nation. Congratulations to everyone who works here, really, that made that happen. But a special thanks to Dr. Wilhelmina Visa-Ramesh and her team for getting us into the top 40 teaching hospitals for the first time. Exactly. Rectal cancer care earns national recognition. Brian D. Jellison Cancer Institute has earned accreditation from the National Accreditation Program for Rectal Cancer, recognition that is only granted to those programs that are committed to providing the highest quality care to patients with rectal cancer. Sarasota Memorial demonstrated compliance with rigorous sets of standards that address program management, clinical services, and quality improvement. The Brian D. Jellison Cancer Institute has established a multidisciplinary rectal cancer team, including medical and radiation oncology, surgery, pathology, radiology, and gastroenterology, in order to receive this accreditation. The NAPRC conducts a site every 3 years for accredited programs. Congratulations to the team. SMH is honored for excellence in treating stroke, type 2 diabetes, and cardiac arrest. Sarasota Memorial has once again achieved top honors and recognition for medical outcomes and excellence from the American Heart Association and the American Stroke Association as part of the organization's annual Get With The Guidelines assessments. These yearly awards recognize hospitals and healthcare systems that meet the top standards of care consistently, month to month and year to year. This year, SMH was not only again awarded Gold Plus with Target, Stroke Honor Roll Elite, and Target Type 2 Diabetes Honor Roll. That's a lot of award there. But also received the Resuscitation Silver Adult Award, the highest achievement possible for any healthcare system in its first year of participating. SMH unveils a new pediatric waiting room and it's on the Sarasota campus in RER. The Sarasota Memorial Hospital Sarasota campus recently opened a new pediatric waiting area in its emergency care center to help children and families feel more comfortable during their hospital visit. It's part of a $3.9 million ECC renovation project, which features a new and improved check-in, registration and waiting area, and will ultimately include a new emergency radiology area with an additional CT scanner to expand capacity. The pediatric waiting area is the latest addition of a wide range of resources SMH Sarasota offers to address specific needs of children and families. And I just want to thank several of our board members who came out that day, Sarah Lodge, Britt Reiner, and Sharon Peters, as well as Lori Lane, who led the project, and several of our physicians. Thank you. Senior care ambassadors emphasize human element of healthcare as part of SMH's age-friendly initiative. Our volunteer services department has created a new program for patients identified at high risk for becoming disoriented during their hospital stay or those who need more attention and engagement. Senior care ambassadors are specifically trained volunteers who travel from unit to unit in the hospital, checking in on and visiting with patients. Ambassador training includes not only conversational skills and techniques to reorient, calm, income for patients, but also how to use pharmacological remedies to provide a healing atmosphere. Graduate medical education. Last month, Sarasota Memorial's Emergency Medicine Residency Program celebrated its annual research day. 30 papers were presented at this event, which celebrated excellence and innovation and collaboration. In addition, internal medicine residents, a number of them, recently presented at the Association for Hospital Associations Virtual 2022 Institute. Podcast focuses on genetic counseling. The latest episode of SMH's HealthCast features lead genetic counselor Nicole Wood of the Brian D. Jellison Cancer Institute, discussing how genetic counseling can be an important component of cancer prevention. While not every cancer has a genetic component, many patients with an active cancer diagnosis or family members of those who have had cancer see genetic counselors to learn about treatment options and prevention in the future. And I would encourage everyone to go on and listen to our HealthCast, our various HealthCast podcasts, because I think they're very informative and well done. And that is the end of my report, Madam Chair, and I'm happy to answer any questions.
Questions for David? Well, thank you very much for that excellent report and all the good news. And thank you to all the teams that make it happen and make us so proud of Sarasota Memorial Hospital. Okay, so moving on with our agenda, we have our consent agenda for which there is nothing to report on that. And then we have our public comments. We do have Diane Dessenberg.
Hey there. I am one of your cheerleaders. I love hearing everything here today, but I am here with a complaint, and I'm hoping somebody here can help out. I went over to the St. Armand's Urgent Care Center in May, and I went and had an office visit. I signed some paperwork. I paid them $150 up front, and I asked how to get an itemized bill when I left. And they said, well, call the billing department. So I called the billing department. And they said, well, you're a self-pay patient. We don't give you itemized bills. I said, oh, how do I get an itemized bill? And I said, well, if you request one, then we have to charge you an additional $162 for you to get your bill. So let's reiterate, visit costs $150, but if I want an itemized bill, it's going to cost me an additional $162. I said, well, could I just maybe get the information from you, or I don't need bill necessarily. Can you tell me like the procedure code, the diagnosis code? And after consulting, he came back and said, no, I can't tell you that. Our policy is if you request that information, then we have to bill you $162. And then he suggested I go to the medical records department. And I said, well, who makes this policy? And he said maybe the board did, and I should go talk to the board. I didn't think that sounded right, so I called the patient advocate to see if they could maybe help me out. And they came back, both the billing department and the patient advocate both came back. They said this: you are a self-pay patient, and therefore you get a discount. If you request an itemized bill, you no longer get that discount. You have to pay that amount. So for my $150 visit, they don't consider it as paying for the bill. They consider it as losing my discount. That sounded really wrong to me. So I went to see if that was even allowed. You know, it's my medical record, I should have access to it. And I found in the Florida state statutes that there is a statute covering all this. And it does pretty clearly say I am entitled to an itemized bill, and I'm not to be charged for it. I can be charged for copies up to $1 a page. It's all super laid out, really clear. And so it became clear that probably some lawyers were involved, and they decided to call it a self-pay discount. I would lose a self-pay discount because they didn't want to get in trouble with this. And so I asked again, who do I bad policy, who do I call to talk to? And nobody seemed to know. So I went to the medical records and I dutifully requested the medical record, specifically procedure code and diagnosis code. They were very helpful. They sent it quickly, but it did not include the procedure code or diagnosis code. I got everything else. So I don't really know where else to turn. I'm hoping somebody here can respond. On the face of it, you know, superficially, it's ridiculous to have a $150 bill require a $162 payment to get the bill. Legally, I think you probably are not in a great position to support that based on the Florida statutes. And morally, it seems, you know, wrong, because if you're gonna bill me for it, you should be able to present me with a bill that tells me what you're billing for. So I'm hoping somebody can help.
Okay, how about if I try to answer? All right. What you want to ask back? Well, let me, I'm aware of any policy like that. I'm looking over at Bill. He's not aware of that policy either.
It is a policy. It's
Okay.
much more complicated than it's present.
Okay, I don't know the policies, I don't know your policy guidelines. All I know is what happened to me. That's what I.
So let's do this. Let's, Bill, can you get with her right after the meeting, get her name and number and her stuff, and then we'll follow up and get you whatever you need, and we'll work to it.
And I apologize for
Okay.
taking all the board's time, but I really didn't.
You're
know.
fine. It's good to hear, feedback.
Yeah, your situation may be different. I mean, I would thought that there's a policy like that that's related to a lot of insurance issues. Yours may be.
I'm not insured, so I'm a self-pay patient.
Yours may be different, and certainly Bill and Diane can.
Let's work this out. This is not something that should be that hard. Thank you.
Thank you, Ms. Dessenberg. Okay, so next on our agenda is our legal matters with Carol Ann English.
I have no.
And she has no report, so we'll move on to other business. Is there any other business to report? Hearing none, having completed our agenda, we stand adjourned. Thank you, everyone.